Olá a todos, estamos aqui junto com a Simone Kodlulovich, atual presidente da Federação de Radioproteção da América Latina, e temos a honra de estar aqui também junto com o Dr. Mahesh. Dr. Mahesh is the chief physicist in Johns Hopkins and a professor of Cardiology and Radiology. Então, aqui estamos pela iniciativa do latinsafe para fazer duas perguntas rápidas para o Dr. Mahesh. Dr. Mahesh, we would like to know, as a president of latinsafe and together with Simone, how do you see the importance of these initiatives? I mean, the image gently and the image wisely, and how does latinsafe can help people in Latin America in that regard?
Personally, I find this to be very helpful for a patient population. Like when Image Gently started in the US, the awareness about the imaging for the pediatric was a big thing. Actually, the Image Gently, which was followed by Image Wisely, is found to be a very good success from the social media campaign. Because we always talk about radiation issues among the professionals, but Image Gently, Image Wisely, now with the Eurosafe and latinsafe, this will provide us to tell or communicate an issue with the general public, with the patient population. So because of that, now more and more public are now aware about this issue, and they are beginning to ask questions, which is, am I done in the right way? Which is a good thing. So I am very strongly in support of this campaign, because it has really brought a lot of not only educational aspect, awareness about issue, and also bringing that an optimization is very critical, not just dose reduction. So over the past few years, we have seen this more and more patients talking about these things, which is a really good thing. So I see the same thing with latinsafe, because compared to in the past, now whatever done in any US or Europe is immediately getting everywhere. And here also you are seeing a lot more CTs are done, a lot more imaging is done. And with these campaign, I strongly believe that latinsafe can make a lot of difference to your patient population. Because not only you are paying attention for dose optimization, some clinics, the patients will start asking them. So when the patient asks, immediately the physicians or radiologists who are not part of it would like to become part of it. Because they okay, because that's what my patient is asking, so I want to be careful. So in reality, how much has this impacted? We don't know nationwide. So currently in the US, we are working on a national committee on radiation exposure to US population from medical exposure. We had that in 2009 report. It's been now 10 years. So now the committee under the NCRP is working on a new committee, the report. And we don't know what's the answer going to be, but we are hoping it will be less than last time. That will really be support of it's because of all these other efforts. And the committee is still working on it, and we are already seeing indication that even though the number of CTs have increased, but this optimization may have some impact. And hopefully by next year we'll know that. That will if it has happened really, then it really strengthened further about the success of this campaign. And of course, latinsafe, which is you are starting here, and I see that very strongly helpful for the patient population. And especially, as you can see here, with limited resources sometimes, more and more we talk about education and awareness about this issue, that the users, the radiologists, the technologists, and the physicists combined together can make a difference.
Great. And as you said, in education that might be the key.
Yes.
And you believe that education has to follow not only health people involved, just as technicians or doctors, but also the patient as well.
Yes. And so education and awareness makes a lot of difference in the overall one. So for example, a lot of the professionals like yourself, we work and try to do our efforts, but if you want more people to know about it, it's this type of campaign. And if this, like imagine this latinsafe, the media, the journalists will pick up it, in fact. They can be really a good vehicle to spread it even more. So as a latinsafe, as you are launching this campaign, you should also talk to your media journalists, telling like, try to get articles about it and some interviews and articles in the media paper, so the general public will begin to know what is that. So when they know those things, you can actually tell, like, here are the 5 things your patient should ask when they are asked to get an imaging. Are they getting in the right way? Are they using the recommendation what latinsafe says? Is my child will be safe with using? So these type of information, if you go to the public, that way, that will be even more successful in the sense it helps the latinsafe and even this campaign to spread in the area. So, but it is a process. But education and awareness is very key.
Great. Thank you very much for your time.
Oh, you
We
are.
appreciate it. Thank you very much.
And I wish you all the best for the latinsafe.
Thank
And I
you.
know it's going to be a success.
I think
Thank
so.
you. Thank you.